Health and well-being is not just related to the medical care that we receive. What makes a huge difference is our environment. So our physical environment, our social and economic ability, our environmental choices, our health choices, and those are things that we call the social determinants of health.
What impacts one of us impacts all of us. I believe there is strength in numbers.
Community health has to be a community-wide undertaking.
That community knows what they want to see. They know the future of their community. They believe in that future. They just need the help to do it.
Our footprint is the Mon Valley and the South Hills of Allegheny County, which covers a wide community.
This region is suffering.
First and foremost, poverty and struggling families in our community. It's access to resources. There's just not a lot of nonprofits out here in the South Hills doing the work that we do.
One of the biggest issues we struggle with is accessibility. Folks' ability to get to local hospitals, shopping centers has really decreased.
This area has aged. The population is older, the facilities are older, and the income base has deteriorated.
Our job is to try to restore that, to try to redevelop those properties and try to create those jobs.
We are the safety net.
Pathways out of poverty.
We've been fortunate to be able to help new immigrant communities find support, hope, a voice.
The South Hills, it's changing every day. New families are coming out here, and they expect the services that we have not been able to provide in the past to be there for them.
We want to make sure we represent the entire community and its changing demographics.
Jefferson Hospital in March of 2013 became a partner with the Allegheny Health Network and with Highmark Health. That was the formation of the Jefferson Regional Foundation.
The Jefferson Regional Foundation is really a community leadership point. We found opportunities to make investments into the South Hills. But more than anything, we've brought the community together.
And we actively engage with various partners with the foundation, looking at where the needs exist.
This year we'll be able to put $2 million in grant-making investments back into the community, and that we hope can make a real big difference. Our first big project was building a playground in Prospect Park.
Shining a light on hunger in America, I think, is what this is about. It is also about eliminating the stigma of seeking help when you need it because it's there for a reason.
One of the biggest issues that is going to affect our region lurking over the next couple of years, which is the baby boomers hitting retirement age. We have a tremendous amount of our local population that is about to drop out of the workforce. How are we going to house and provide for those folks? How are we going to fill those jobs?
We actually received a grant from the Jefferson Regional Foundation to really impact health disparities that are existing in the South Hills and the Mon Valley.
The three of us run after-school programs as well as summer camp programs in our local communities.
The Latino Family Center keeps expanding with classes and activities for families, children, and adults.
We connect new moms with volunteer mentors.
Cribs for Kids identify and deliver cribs to families that really lack those resources so that their children would be in a safe sleeping place.
We at Squirrel Hill Health Center providing comprehensive care to everyone and have a special focus on immigrants and refugees with limited English proficiency.
EDS has been working with a great coalition of churches, government officials, schools, other nonprofit leaders to revitalize the Clairton neighborhood.
Another way that we're really engaging is building the idea of a forum.
Just very energized and excited about what we experienced that day and the potential opportunities that were ahead for us.
While this is only our second forum, it will be a regular forum for us going forward.
The other thing that my relationship with the foundation has done is connected me with other agencies that I never really thought about, and they never really thought about us.
It was wonderful to make those connections, and then even more wonderful to have that conversation continued in the form of the collaborative, and that's been the most exciting part of the experience.
The teams that are working together, we are calling collectively the Jefferson Community Collaborative. And so over the past year, dozens of the groups have continued to meet together in 3 teams working on strong families, healthy residents, and thriving communities.
This is the first time that we've been able to interact with organizations who are also like us serving families in the South Hills. We found new resources, we've developed new partnerships.
And now we have phone numbers, and I'm going to call Jim and say, here's my family in the Prospect Park, can you help them?
The Jefferson region has a lot of promise. The key is to be able to integrate resources.
Working in collaboration with the foundation, working with other community partners so that we can bring all of our talents together.
We'd like to see more vibrant and diverse communities here, and it's already growing, moving ahead in a positive direction.
The more institutions and entities who are part of this, who have common goals of really partnering with area residents, the better off everybody is. And I hope the result is healthier people living better lives and staying here in our region.
We just want a vibrant, healthy community.